As a resident of Idaho, it was shocking and upsetting to discover the degree to which access to healthcare is limited in rural areas. However, as a nurse working in Idaho, it wasn't surprising at all. Nurse practitioners can have a significant positive impact in this area if they are empowered by policy to do so. This policy brief will highlight the factors which contribute to this issue, and it will also make recommendations for some legislative actions that the Idaho legislature and the United States Congress can and should pass to mitigate the consequences which every Idahoan has been forced to endure. There are several studies and reports available that detail Idaho's healthcare shortage and its consequences. There are barriers of all kinds that have come together to create a perfect storm, if you will, which has resulted in a lack of access to healthcare. According to the Idaho Department of Labor, Idaho has 44 counties, of which 35 are considered rural. 18 of those have fewer than 6 people per square mile. That's pretty rural. In 2024, the Association of American Medical Colleges stated that Idaho is last in the nation for physicians per capita and declared that 98.2% of Idaho qualified for the designation of a health professional shortage area, which is also called an HPSA. According to a paper published by Corbin earlier this year, Idaho needs an additional 1,400 providers just to barely meet the national average of providers per capita. A study published by Arredondo et al. In 2023 stated that only about 10% of all physicians work in rural areas. Over half of these physicians are at least 55 years old, and that means they're going to be retiring soon, but the problem is that as they retire, they're not being replaced by younger providers. In 2025, Lutz revealed that providers who train in rural areas tend to stay there and set up practice. Unfortunately, only 1% of graduate medical training programs are in rural areas. In 2020, the American Association of Nurse Practitioners released a report that stated 90% of all nurse practitioners are certified in an area of primary care, and they are more likely to settle and practice in rural areas than physicians are. So the American Association of Nurse Practitioners, they've called on Congress to change existing laws that would allow nurse practitioners to practice in all 50 states at their full capacity. A few rural health clinics operated by nurse practitioners have been opened in Idaho. They've been a great help for the residents who live in that area, but even in states that allow full practice authority, such as Idaho, existing law still requires physician oversight of these clinics. And that law comes from some Medicare and Medicaid laws, which are federal, and so because they're federal, they supersede the state law. So this understandably limits the ability of nurse practitioners to open such clinics. According to a 2020 overview of Idaho, there is a shortage of obstetrical providers in Idaho. Rural women in Idaho are less likely to access prenatal care. They have a higher rate of unintended pregnancies. They have lower breastfeeding rates, more preterm births, and a higher prevalence of obesity and smoking during pregnancy. The women who do seek prenatal care must drive to Boise. Babies delivered in other hospitals must be transported elsewhere, so to other hospitals that have pediatric or neonatal intensive care unit floors. There are only 137 pediatricians in the entire state of Idaho. That means that for every one pediatrician, there are 3,000 children. And we all know that that's not a good number to have. There's no way providers can see that many patients. An article by Jarvis, 2025, examines consequences of the lack of healthcare access in rural areas. Two of the most devastating results are higher rates of chronic disease and mortality, as well as an increased financial hardship for patients who must travel to get to the nearest provider. And in addition to the barriers that living in a rural area provides and the lack of medical providers, there are other components of this problem. Several of these affect nurse practitioners particularly. Reimbursement equity is one barrier to nurse practitioners practicing in rural areas. According to the 2026 fee schedule from the Centers for Medicaid and Medicare and Medicaid Services, nurse practitioners are compensated 85% for Medicare and Medicaid patients, while physicians receive 100% compensation. What's more, according to the Code of Federal Regulations in 2026, NPs are not eligible for scholarships and loan repayment programs that physicians enjoy, which would encourage them to practice in rural areas. In January 2026, Idaho state legislators submitted a bill entitled Train Here, Stay Here. This bill would expand undergraduate and graduate medical education programs by adding 30 new residency seats over the next 3 years. Data presented by Lutz 2025 indicates that providers tend to practice, at least for a while, in the state in which they complete their residency. If Idaho can provide more residency seats, it's likely that more physicians will stay in Idaho. NPs should be allowed to practice at their full potential in every state in the country. David 2025 describes legislation entitled the ICANN Act. It was initially introduced in 2022, but it was defeated, and then it was reintroduced in 2025 in the House of Representatives and in the United States Senate. It has bipartisan support in both houses. This bill amends Titles 17 and 19 of the Social Security Act to remove Medicare and Medicaid barriers that prevent APRNs from practicing to the full extent of their scope. Since it has bipartisan support, Congress should bring it to the floor for a vote so that President Trump can sign it into law. Full practice authority includes allowing nurse practitioners to run healthcare clinics in rural areas without physician oversight. According to an article published by Mann in 2025, the Modernizing Rural Physician Assistant and Nurse Practitioner Utilization Act addresses this issue. It amends Medicare rules for rural health clinics, removing requirements for physician oversight, and aligning federal and state laws which would allow physician's assistants and nurse practitioners to practice independently in rural health clinics. Nurse practitioners choosing to practice in rural areas should have the opportunity to apply for and receive scholarships or loan repayment programs such as the ones that already exist for physicians. According to the Code of Federal Regulations, in 2026, the National Health Services Corps has programs that award all providers up to $75,000 for a full-time 2-year commitment to practice in a health professional shortage area. Although nurse practitioners are eligible for this, they aren't prioritized equally to physicians in the reward amounts. So expanding this program to provide equitable benefits to nurse practitioners would incentivize practice in rural areas. Finally, nurse practitioners have access to the same reimbursement rates from Medicare and Medicaid as physicians. They should have access. The 2026 physician fee schedule under Medicare Part B should be amended to provide NPs with 100% reimbursement just as physicians receive. Access to healthcare is extremely limited in rural America, and Idaho is no different. This lack of access leads to higher rates of chronic diseases and mortality. As there aren't enough healthcare providers in these areas, and especially in Idaho, it's essential that this issue and its contributing factors are addressed more aggressively through legislation. As such, the ICANN Act, Modernizing Rural Physician Assistant and Nurse Practitioner Utilization Act, and Train Here, Stay Here bills should be codified. Reimbursement rates from Medicare and Medicaid should be increased to 100% for nurse practitioners nationwide, and scholarships and loan repayment programs through the National Health Services Corps should be expanded to more equitably include nurse practitioners. Thank you for taking the time to listen to my health policy brief. Bye-bye.